Hey guys, it's Dr. Justin Southall and Dr. Toby Southall from Eastern Shore Chiropractic and Sports Clinic. Today we're going to talk about plantar fasciitis and how you can self-treat it at home so that you can get rid of this nagging, terrible pain. First off, what is plantar fasciitis? Typically, plantar fasciitis is described as that terrible, gnawing, dull, aching, sharp stabbing pain that you feel first thing when you wake up in the morning. That first step that you hit the ground is just killing you, and then after you walk a little ways, the fascia and the muscles start to lengthen and stretch, and the pain starts to decrease. Then after you sit for a period of time, it tightens, shortens back up, and the pain returns. Thus, every morning after you've slept, it's painful again. So how can you treat it at home? We got a few simple ways to do it, and we're going to start out. Dr. Toby's going to be our model today, and I'm going to have her take a seat. The easiest way to start is using this lacrosse ball. So we're going to take a seat here. And at home, what you'll do is you can start out with a tennis ball. Sometimes the lacrosse ball is a little too advanced, but the tennis ball will be applied right underneath the foot, right on that fascia. So there's several muscles. There's actually 33 joints in this entire foot. And so by mobilizing the fascia, it'll allow the joint restriction to decrease, and it'll increase mobility of the foot. So as we're applying pressure through here, you're going to look to find that hurts so good spot. Just like the mobility stuff we've talked about before, we don't want it extremely painful, more of a hurts so good, trying to get that fascia to release. She's going to do this for anywhere from 15 to 30 seconds on each of the tender spots that she finds. There could be the whole fascia, or it could be just one or two little spots that's contributing to the pain. So she's going to work through there, and you're going to do this every other day. Sometimes every day, just depending on the degree of it, but at first it'd be every other day. After she's done working with the ball, she's going to cross her leg, bring it up, and what she's going to do is she's going to reach through her toes with her fingers, interlacing the toes, and she's going to grab the ankle, and she's going to do some joint mobilization. All she's doing is stretching this, and then she's going to pull the ankle into dorsiflexion, as well as pull on the toes, which is going to stretch and lengthen the fascia, as well as all the supporting musculature in the area. She's going to do this, hold it for 15 seconds, work up to a minute, good stretch, and this needs to be done 3 and 4 times a day. If you're sitting at work watching this and you got, oh my gosh, I got plantar fasciitis, try this right now and then get up and see if it doesn't feel better. So you're also going to take that stretch and you're going to run your own thumb right through that muscle and fascia with a little bit of lotion. Any type of lubricant would be good, running it right through there to get that release. Just trying to get that muscle, that fascia, just to let go. So is your foot pain just caused from the foot? No, it can be from calf, hip, it can be a weakness. So we're going to look at the calf too, and we're going to move right over here, and we're going to talk about a couple more mobility things you can do. So go ahead and take a seat for me. So this is just a simple trigger point kit that you can get at your local running store or online. And this is actually designed for the soleus, the tibialis posterior, and the flexor hallucis longus. So they're going to place the roller right into there, and she's going to move it back and forth nice and slowly. Once she finds the area that is restricted or really painful, she's going to pull the foot, and she's just going to push it down into plantar flexion. And she's going to do this multiple times, trying to get that to release. As it gets easier, as she does that, she's going to cross this over, which is going to apply more pressure, and do the exact same motion. 15, 30 seconds max every other day. Go ahead and stand up for me. And the last thing you're going to be able to do, because stretching is so important, you're going to be able to do a lot of calf stretching. So one of the things that she can use is a simple slant board. This is called the bob. But what we're doing is a modified version, which is even more effective for our purposes. So this is a voodoo floss. You can get it from Rogue Fitness. And you can start in the foot and wrap up. Just for demonstration purposes, I'm going to start at the lower ankle, and I'm going to work up. And I'm pulling this really tight through here. What this is going to do is going to, A, restrict some blood flow. B, it's going to allow the muscle and the fascia to come apart from each other so that the tissues glide like they should. And 3, it's going to return that blood flow back, flushing out white blood cells, anything that causes inflammation, returning her range of motion to normal. So she's going to come stand over here on the bottom, and she's going to do the stretch. It's going to be a nice pull through here. Go ahead and raise up. She's going to go into a calf raise and back down, which is just allowing that fascia and the muscle to slide over each other as well as the skin. Good job. So again, let me take this off of you. Again, this is Voodoo Floss that you can get at roguefitness.com. Works well for most any joint problem, any muscular issues, fantastic. And this is just a few simple ways that we're able to treat plantar fasciitis at home by yourself with just a few simple tools. Again, this is Dr. Toby Southall. This is Dr. Justin Southall, Eastern Shore Chiropractic. We are your Fairhope Chiropractor. It's your life, live it in health. Thank you guys.